Welcome to Dr. Osawe's Small Bites, where today we shall discuss matters of the heart and mind. Now, here's your host, Dr. Osawe.
Hi everyone, it's Faithful again from Dr. Osawa Small Bites. I've been thinking about I've been dealing with the last few months, and with Dr. Osawa Small Bites is a very good way. I was trying to look at life and what I deal with and try to tie that in with stuff I know in medicine, cardiology, and more, and trying to tie that out to bring up things that we can help each other out with, and I can use the knowledge that I have to help someone here and there. So I noticed the last few months there's been a lot of anxiety in my life, to be honest. Being vulnerable, I felt like there was a lot going on, with work and then with the kids. Kids are very busy with school, and then they go karate, gymnastics, basketball, music, so much going on as a mother. I have to be in front of that. And then with my husband as a wife, I have to be present as well. Then with my parents, a lot of things with health, and even my siblings and life in general. Sometimes at work, a lot of things happening at the same time. And with the kind of very busy kind of schedule that I have, anxiety, and somehow I started to have some symptoms with palpitations and things like that. So I thought to pause and think about, why am I having these symptoms, and is it just my heart something's going on with my heart, or is there some kind of anxiety? And I kind of started to make sense of anxiety and the heart. So I want to talk about anxiety and the heart today. So sometimes a wave of dread comes over you, your heart flutters, you can breathe. The classic anxiety symptoms are sometimes mistaken for a heart attack. And for a good reason, of course, because when you're anxious and many things that comes along with that. Patients come to me a lot of times with feelings that may seem anxiety provoking, or from just having this panic attacks. They don't know if it's the heart or not. When someone is anxious, their body reacts to things in many ways that can put extra strain on the heart. The physical symptoms of anxiety can be especially very, very disturbing, and can even cause cardiac disease or heart attacks, or those that have existing cardiac disease. It can even make things worse. Emotional turmoil triggers the release of stress hormones, which act on the same brain areas that regulate cardiovascular functions, such as heart rate and blood pressure. So when this happens, people can have symptoms of anxiety. Anxiety puts significant strain on the heart through the fight or flight response, leading to chronic high heart rate and blood pressure, increasing risk for heart disease, heart attacks, and stroke over time. Now, what's a fight or flight response? It's an activation that occurs when things like anxiety or stress triggers release of stress hormones like adrenaline, cortisol, increasing the heart rate, blood pressure, and inflammation, which strains the blood vessels and the heart muscle. With chronic anxiety, with chronic stress, there's persistent activation. This activation leads to elevated heart rate, high blood pressure, which can cause hypertension, and inflammation that increases. With inflammation, this damages the arteries, the walls of the heart, and what happens is that it promotes the buildup of plaque. And this plaque causes atherosclerosis that raises the risk of heart disease and stroke and peripheral artery disease. A malfunctioning stress response promotes inflammation, which damages the artery linings and sets up the stage for buildup of coronary plaque. People with very high energy levels or anxiety levels tend to have lower omega-3 fatty acids, and these lower levels may be linked to higher risk of heart disease. The presence of anxiety and depression also appear to make platelets stickier, so blood can clot. In very serious cases, anxiety can interfere with normal heart function and increase the risk of sudden cardiac death or cardiac arrest. When you have decreased heart rate variability, it may result in higher incidence of death after an acute heart attack, or issues with the heart, or even other stressors like even sickness or illnesses. And a lot of people that are anxious tend to have unhealthy habits, which can lead to smoking, poor diet, overeating, the lacking of exercise, use of alcohol more than they are supposed to, use of caffeine more than usual, all of which can trigger a lot of major risk factors for heart disease, or even palpitations and increase in activation or heart activity. And anxiety can cause a lot of symptoms like this that are very detrimental to our health. Now, what are the anxiety-related symptoms that we can experience? Like I told you, I was having a pounding of my heart. So this we call palpitations. A strong, rapid, or fluttering heartbeat, sometimes people feel like their heart is skipping a beat or flip-flopping. Patients come to me and say, oh, my heart is flip-flopping. Chest discomfort can cause tightness or fluttering or vague sense of discomfort in the chest. Rapid heart rate, called tachycardia, can occur where the heart beats much faster than normal, and sometimes shortness of breath can occur where patients feel that they're hyperventilating or breathing so much faster or deeper than they should. So there are many kinds of anxiety disorders that can fall into various categories, and I will highlight a couple of them. One is panic disorder. It can be associated with cardiac disease or can be mistaken for a heart attack, where patients feel the extreme agitation. They can feel like terror as though something is going to happen, a sense of doom that may accompany dizziness and chest pain, stomach discomfort, shortness of breath, and rapid heart rate. During this time, patients feel like they're going to die and they are so panicky at that time. Another kind of anxiety is post-traumatic stress disorder. Follows a shocking or frightening event or incident where there's a sudden life-threatening event such as a violent crime or major accident or heart attack or some death in the family, and a person suffering from PTSD often have trouble with dealing with anything associated with that incident that caused the condition and experiences feelings of jitteriness and detachment. Sometimes patients can have a lot of anxiety provoked by things that are around that certain incidents. Another kind of anxiety is obsessive compulsive disorder. These are when people have that have OCD, they manage unreasonably thoughts and worries by performing some actions over and over and over. For example, a patient can or someone can be obsessed with certain cardiovascular disease that they come to the hospital all the time saying, oh, my chest hurts, I'm having palpitations. Some people can also feel like they have to clean their hands a lot or wash their hands all the time because they are scared of having illnesses or getting sick with viral infection. And research is showing more and more that this creates a lot of anxiety and can increase risk of cardiovascular disease. There's a big one that actually a lot of people suffer from that I want to highlight today. It's called generalized anxiety disorder. Mental health condition characterized by excessive, uncontrollable worry about everyday things. You worry about a lot of things more than you should. It causes significant distress. It affects daily life through fatigue, muscle tension, sleep issues, trouble concentrating, irritability or restlessness. And treatment often includes some therapy, which we'll talk about, medication and lifestyle changes. This can be so detrimental to patients' life because they are finding themselves all the time just overthinking things, getting so anxious that they start to have a lot of problems sleeping. They wake up at night gasping for air because they cannot breathe. They feel like their heart is racing a lot of times, even during the day when they're resting, doing absolutely nothing. Now, I always try to explain that anxiety travels with other companies like stress, like depression. In fact, anxiety and depression are likely two things that tend to occur together. Most people that have anxiety tend to have depression and vice versa. And those people that suffer from anxiety and depression at some point in their life have a very, very high risk of heart disease or heart issues. We are also trying to learn that long term, this stress can be a precursor for heart condition. Now, it's very important to know about the heart effects of anxiety, of depression. The relationship between heart health and depression is very well documented. There is a mountain of evidence that shows that with anxiety and heart disease, they're linked to a lot of things. Someone that has generalized anxiety disorder, that have a lot of panic attacks, they can have heart attacks or they can have issues as they get older, because even as we get older, our risk of heart disease increases. But when we do if there's a lot of anxiety in our lives, this can increase our risk or an intensity of heart issues that may come along. Now, there's still so much to be learned about anxiety and the heart, but we know that it's very harmful effect. Many people find that taking a lot of things together may help, so they try to do therapy, they try to do medications, which I'll come to. But one thing that is important to know and to realize is that with anxiety, it can become a burden in our lives. One thing that I want to always, when my patients come to see me, I try to see, is it anxiety or is it stress that's causing the symptoms they're having, or is this a heart issue as well? So I want to say, distinguishing between a panic attack and a heart attack may be difficult to distinguish or to differentiate. Even when people come to see the cardiologist, we may have to do certain testings to rule out heart disease so that we can say, okay, surely this is panic attack, this is not heart disease. So when panic attacks are occurring, I would recommend that anyone suffering from this sudden severe chest pain that may occur or palpitations seek medical help. If it's very severe, go to the emergency room, see a physician who will test and see if there's any issues that should be tested further regarding the heart. If there is none found, then it's very important to kind of deal with this anxiety and panic attacks that you're dealing with. Cardiologists that is sensitive to issues of anxiety and depression can be able to distinguish sometimes between panic attack symptoms and heart issues or heart attack symptoms when you're referred to one, especially if you need to see a cardiologist regarding this. And I would encourage you, if you're doing a lot of anxiety and you are having a lot of symptoms that cannot be distinguished when you don't know if it's heart issues or not, to see a cardiologist, or even you talk to your primary care doctor, who, if he's not sure, can refer you to one. Distinguishing and diagnosing and treating anxiety is very, very important because, like I said, long term it can become an issue with the heart. It's important to differentiate and treat anxiety when it's found, because anxiety can be a problem as we go on in life. It may be fine now that you're younger, but as you get older, especially if you're older, please make sure you get care. You need to ask yourself to differentiate between normal anxiety and anxiety that is more severe or that is not normal. So when you do have anxiety and you feel like it's starting to affect your quality of life and interfering with your family life and keeps you from being productive in your professional life or your work at home, ask yourself, does it restrict me from engaging in regular activities that I like? If the answer is yes, then it is very important that you get treatment for the degree of anxiety you're having. By one, therapy can be a big way that helps. Medical treatment, depending on the duration and severity. By seeing a doctor, they can be able to tell you what you may benefit from. Sometimes, like I said, commonly they can have cognitive behavioral therapy. You can also get treatments with medications like SSRIs, can be treatments that can help with goals to keep the patients from having too much issues with anxiety, increasing concentration, decreasing risk of patients having palpitations and flutters. I have had patients that come to see me, I give them some anxiety, and they come back, Dr. Osawe, I feel much, much better. I don't have any of these palpitations anymore. My shortness of breath has gone away. My feeling like my heart is fluttering. My chest pain is gone. So all these things can be very, very helpful when you see a doctor if anxiety is the cause of your symptoms. Cognitive restructuring. People with anxiety disorders tend to catastrophize. What does that mean? They want to kind of make big what they're dealing with to kind of make sense of why they're so anxious. So for example, someone says, oh, you know what? I dealt with this happened in my life. And since then, I feel like I'm doing this, I'm doing that. I'm very anxious all the time. And they try to make and capitalize on that one thing and destroying or making their life, or they're making everything about that to kind of explain or to make sense of why they are so anxious all the time. That is not a good way to deal with anxiety. So cognitive restructuring, where you can talk to someone who can make sense, a logical sense and steps to help you process what this is and to let you understand that that's not a healthy habit, can be very helpful. Maybe you lost someone in your life, and of course that's a big event, or maybe being in that place where you are making it just control everything you do. Don't get me wrong, I know it's very important to deal with that, but also finding people that can help you go through that can be very helpful in your life. And when we do that, that can help you with making sure that you are getting the right care. Now, exposure therapy seeks to gradually and repeatedly expose the things that you're anxious about. People that have PTSD, going through that a lot, they have people that can help them kind of go through that event over and over again. That decreases anxiety. Example include overcoming a fear of maybe crossing a bridge, going up a plane ride or something like that because of something they've been dealt with before. Very often, doctors recommend a dual approach that combines psychotherapy and medications. If you need that, that is something to definitely not hesitate to consider. And as you do that, I'm sure that anxiety would be kind of decreased and can help you just deal with things better. Now, anxiety in women are about twice likely than men to experience panic disorder, generalized anxiety disorder, social phobia, anxiety disorders that, as a whole can affect their quality of life. So if you hear you have a wife who you wonder why she's always anxious about a lot of things than you are, or you have a spouse or someone in your life, maybe your friend, that you wonder, she's a woman, I'm a man, I don't get why they're very anxious. Sometimes you have to remember that dynamic with women. And sometimes there's also a genetic predisposition to anxiety. Some people in their family are more anxious than in their genes than others, so they may struggle with anxiety. If you have someone, you know someone who is dealing with that, maybe your spouse, knowing this now, be able to help them to deal with that. But remember, all in all, life is stressful, life is hard. There's a lot of provoking things in life, just even what's going on in the country, our kids going to school, in the environment, that can make us very anxious. And that's a normal response to what we deal with every day. But finding ways to deal with this stress by yoga, by meditation, by trying to find time to just take out of your crazy schedule, maybe one day with to rest. Just a restful day may be helpful. I'm trying this and I know that it's really, really be helpful for me. So I hope this has been helpful for you. If you have any questions, please do not hesitate to reach out at any time. Please like and subscribe and share with others. Thank you so much. I hope you have a wonderful week ahead and a happy month ahead. Take care. Bye-bye. Much love.